Hey everybody, it's Ed O'Keefe and welcome to another episode of America's Leading Experts. I'm super excited because today I have Dr. Ashim Wadehra of theartoffoot.com, which is pretty amazing because you're a regenerative medicine doctor, you're a podiatrist,
Yep.
and you're able to help people with so many things, including pain, restoration, and healing. So welcome to the show.
Thank you, I appreciate that.
This is pretty awesome. When we met each other through a mutual friend, and I was so intrigued because you're one of the first podiatrists I've interviewed, but also that is moving into the fast-growing regenerative medicine category and movement.
Yep.
So welcome.
Thank you, appreciate that.
Awesome. So where are you from?
So I'm from Detroit, Michigan.
Okay, so you
Yep.
practice up in Detroit.
Yep.
Great.
Yep.
And so my show is always about highlighting what people are doing on the cutting edge.
Mm-hmm.
You're obviously doing amazing things like that. Would you mind, before we get into stem cells, exosomes,
Yep.
and regenerative medicine, will you mind giving everybody kind of like a 30-second or 3-minute backstory
Yeah.
on how you got into becoming a doctor? And
Yeah. So I'm a podiatrist, foot and ankle surgeon, double board certified, fellowship trained. As soon as I finished my fellowship, I went into sort of that traditional foot and ankle surgeon practice. I joined an orthopedic group. I was working with them for several years, doing again all sorts of foot and ankle reconstructive work, prescribing my patients the traditional pharmaceutical model type of steroids, opioids, and so forth. And it was working well for a bit. And then I started to notice that, surgery is helping people, but it's still taking a really long time. In some cases, it wasn't helping my patients.
Yeah.
And then just doing what I was trained by my mentors, right? Prescribing the physical therapy, just doing the traditional model, right? Like we've all been through it. I started to see a lot of frustrated patients come back to me, and I was doing a good job with the procedures. X-rays were looking good. They were following the physical therapy. I was giving the medications like I was taught.
yeah.
But it was just taking so long to heal them, and in some cases, they just weren't getting the results that we were hoping for.
Right.
And so it really led me down this sort of like frustrated burnout path, if you will.
Yeah. Like the process was, you were doing the process accurately, the model was just broken.
Yeah, exactly.
And it's a model that was good to get you a certain direction,
Right.
but there was a point where farmers tilling the soil by themselves, machines were just way more efficient, better, and actually worked better. If that's a good analogy, I don't know. Or people used to ride horseback cross country. Now you have trains, right?
More
and
efficient
airplanes.
model.
Yeah. So you started asking yourself. What I'm hearing you saying is you're asking what's a better way? There's got to be a better way to help people.
Yeah. No. I mean that's the main reason why I went into this field was
In
to
the
help
first
people,
place,
right?
yeah.
Yeah, exactly. And so I would go back and speak to my teachers, my mentors, and kind of the answer I'd get back was, this is just kind of how it is,
Yeah.
They'll eventually get better,
Yeah.
but this is just how it is.
Well, we know that's not the truth
Exactly.
because people go from injury, pain, inflammation, and it's a slide to surgery at the end of it.
Glide path to surgery.
A glide path surgery. Thank you.
Yeah.
And our mutual friend Dr. Scott talks about if your child put their hand on a burner,
Yeah.
you wouldn't just say let's put medication over it or let's give more.
It's covered up, yeah.
Let's cover it up.
Yeah.
Let's get your hand off the burner and,
Exactly.
and take care of you. So, so where has that led you? Where
Yeah.
give us this. Give us the story.
So it's interesting how I came to this point. So in that practice, that orthopedic practice, one skill set that I learned was minimally invasive surgery. So what I was able to do was take my surgical skill set, where I was making these big incisions, do the same type of procedure, but through only a 3 millimeter or an 1/8 of an inch incision.
Okay.
So that right off the bat started to bring better results for my patients. They were walking the same day. There was less post-operative complications. The incisions were so small, so we were getting less infections. Patients were less at risk for blood clots because they were able to walk the same day, and there was just less inflammation overall. So right off the bat, when I implemented that into that orthopedic practice, I already saw a sort of I wouldn't say 180, but I definitely saw a better outcome for my patients.
Yeah.
And it was during that time where I started to learn more about regenerative medicine and so forth from other colleagues. And that's when I decided, you know what, I'm gonna leave this orthopedic group, and I'm just gonna start my own practice where all I do is minimally invasive foot surgery.
It's a big commitment and jump for you, probably at the time.
It was. I mean, it still is, obviously. But I needed a change for myself because, again, like I invested all this time in my schooling, my training to help people. And again, like I said, I wasn't really getting the results I wanted for my patients.
Yep.
And then, long story short, when I found this minimally invasive surgery technique, I saw other people creating practices revolving right around this technique, only around this technique, and adding some regenerative medicine. So I left, started a practice from complete scratch, had no idea what I was doing. I was like,
Wow.
I'm just gonna do this by myself. Let's get this going. And then I started my minimally invasive surgery practice and getting good results. And then that's when I started to also implement the regenerative medicine and layer it on top of my surgery.
Okay. Yeah.
And I saw just a profound result with the
Really?
Regen Med. Yeah, and then we have a plethora of non-surgical things that were coming through the door, like plantar fasciitis or heel pain, Achilles tendonitis, different types of arthritises and stuff like that. Or, patients would come to me and say, hey, I heard from so-and-so that you did this for them. I'm not looking for surgery, but I heard you can use your laser or your shockwave machine. And I want to try that before I have to go through this big surgery with another doctor. I'm like, let's just try it and see how it goes. And yeah.
Okay, cool. So let's break some of this down because this is really good. It's really interesting. So regenerative medicine, we're gonna define that in a second, everybody, just so we're on the same page. But I'm just so intrigued with what are like the conditions and why are people coming in who, if they knew that what you're doing with minimally invasive or no surgery, but you layer on regenerative medicine, could get them exponential better, I don't want to say better because I know it's like medical, but like better results than the old traditional way. Because I mean, growing up in a Southside blue collar family in Chicago, we're only going to doctors. Yeah. Like you're only gonna you have tendon arthritis or tendonitis. Like, well, whatever the doc says and prescribes you is what you're doing. Like there is no, well, could I actually use stem cells or red light therapy or any of these other things? So let's start out with what are the main pain points and reasons why people see you, and then how does that lead to like how regenerative medicine is kind of like the bridge that's transforming lives.
So like what kind of conditions do we mainly see in the office?
Yeah. Why would I go to you? Let me just ask that question.
Yeah. So that's a great question. Why would
and I'm someone who has plantar fasciitis, so I'm always dealing with that. That's a pain in the butt, but yeah.
So what ends up happening a lot of times is a lot of my patients, again, for whatever reason they're dealing with, whether it's the plantar fasciitis, whether it's the Achilles pain, whether it's a torn tendon, a fracture, a chronic arthritis condition, whatever it might be, they've already seen a few other doctors and they've gone through the traditional model of steroids, physical therapy, maybe they've already gone through surgery, haven't really gotten the results. And then they hear about what we do, which is a little bit outside the box, right? This podiatrist is doing something a little different, right? And he does something known as regenerative medicine. And what we're seeing is that he's getting patients to, truly start feeling better without the need for these big pharmaceutical medications, without having to waste time through physical therapy. And I'm not saying that physical therapy is a waste of time. I actually think there's a great place for physical therapy, but the point is like we're not subjecting our patients to the knife right away. I'm not saying, hey, okay, we're going to pump you full of cortisone, because what we know with cortisone is that oftentimes it just masks the problem, and that's what a lot of these patients are dealing with already. Is that they've already gone to 3 other doctors, they've already had 3 cortisone injections. Why do you think the 4th one for me is going to be any better?
Yeah, and accelerates osteoporosis and other issues that just gets us to a less better place than.
I think cortisone, again, a lot of times makes it worse because you're seeing bone loss, you're seeing fat atrophy, you're seeing the ligament itself that's damaged become even more damaged because you're doing too much of that cortisone. And it's never fixing the problem. It's just putting duct tape on the problem. So a lot of times what ends up happening is a patient will go get an injection from someplace. It doesn't have to be heel pain. It can be anything, knee pain, shoulder pain, whatever it might be. And the pain goes away for a little bit. And they think, wow, this is magic. I'm healed now. Well, really what ends up happening is we're just muting the pain. It's almost like, I always like to use this analogy. It's like, imagine the TV's on and the volume's up. You hit the mute button. sure, the volume is muted, but it's not like the volume is gone forever. You just turn the volume back on, it's going to be there.
Yeah.
Same thing with this condition. It's that the cortisone is just turning the pain off for a little bit. It's just turning the pain connection between the brain and the area and the pain site. They're just turning that off.
But the body's still shooting the messaging.
Still shooting the message.
It's just not letting you know that the message is
You
coming.
just muted the message.
That's right.
And then what'll happen is it'll wear off.
Yeah.
The patient's oftentimes in more pain.
Worse pain, yeah.
More pain because you haven't really done anything to the problem.
Yeah.
They've just gone about their business. They're back to the gym. They're taking care of the kids the way they used to take care of the kids, doing a bunch of chores, bending up and down this, that, without really taking care of the problem at hand the right way. And so they get frustrated and like, I've done all this stuff, I've listened to my doctor, why is it that it just keeps coming back?
Yep.
Well, let's look at this from a fundamental holistic perspective, and so we take that into consideration and deploy something that truly helps the patient, not just mask the problem, not just mask the pain.
So why are stem cells or exosomes, why do those work instead of what you just described?
Yeah, so I mean, that's a great question. As we get older, what ends up happening is so we know let's actually bring it back for a second. Let's make this very elementary. When we're young, I remember when I was 10, I'd go outside, play sports with my friends, scrape up my shins, bump my head, break a finger. Next day, I'm practically healed.
Yeah.
I do that today at 36. I'm going to be 37 soon. I'm going to be paying for it, right? And in some cases, it takes months to heal from stuff like that. A broken finger, a broken bone, cut finger. The question is, why is that? Well, from a very fundamental perspective, our body's stem cells start to decrease as we get older, right? We know that as a newborn, 1 in 10,000 cells are stem cells. As we get older, they really start to decrease to the point where you're in your 60s, 70s, 1 in 2 million cells are stem cells. Well, those are the cells that allow you to regenerate. And so as we get older and we're having these problems like arthritis and ligament problems and tendon problems and this, your body is trying to heal itself. It's a smart system. It just really doesn't have that efficiency like it used to.
That's right.
Now we have the ability at our fingertips to truly supplement the body with these beautiful cells, if you will, just biology. And it almost jumpstarts the body. It's almost like creating that sort of newborn effect all over again. And it goes so far to even signal your own body stem cells to say, hey, look, you're really not functioning very well right now. Let's just reboot the system a little bit and let's get us functioning a little bit better.
Yeah.
It's almost like a computer that's really, really slow. Oftentimes you just want to reset the computer or restart the computer, do a little update, and then it almost restarts like it's brand new again. That's essentially what we're doing with this.
Yeah, and in a lot of ways too, it's like you're borrowing the fountain of youth from young stem cells and transporting them over to the older body.
Yeah.
Because like a lot of times, especially as we get older, our scratch on our knee, it could be weeks, months, whatever, that it just still is, it lingers in it, and it can cause more. That's a superficial example.
Yeah.
But what you're saying is like inside a joint in the foot or in the tissues.
Yep.
That's a literal example of what we can't see, but that's what's going on.
Exactly.
And what you were saying before, where I thought you were going with it a little bit, and I think you looped it in there, was with physical therapy, it's phenomenal. Mm-hmm. The difference, what you're saying is, but imagine physical therapy if we're hijacking the fountain of youth and injecting it. Now we do physical therapy.
100%.
Yeah, because it's like taking an old door that's hinges are broken, and you can do as much physical therapy with as you want, but really what you're doing is taking duct tape and it's not going to be as efficient. Yeah.
Exactly.
It's pretty amazing.
Yeah.
Can you share, I know patient confidentiality, but can you share a couple examples of types of patients that
100%.
have come in and before and after?
Yeah. So we had a gentleman. Actually, this was at the few months when I started the practice. Actually, had a gentleman has moved to Florida now. He's from Michigan originally. Retired. Really enjoyed playing golf and really enjoyed walking the golf course. He had really bad end-stage arthritis of the ankle, and he had been to a few local surgeons who advised either replacing the ankle, so ankle replacement surgery.
That's a big deal.
It's a big deal. Or fusing the ankle. So really,
possibly a bigger deal.
Yeah, exactly. So both procedures, a lot of downtime. There's
Yeah.
risks with those procedures. There's could be complications. And so, he had heard of stem cell. He knew that we were trying it. And I was very honest with him. He was really end stage. And I go, look, I'm willing to do this for you. But as with anything, I can't give you any promises. I don't want to say that this is going to be it for you. I don't know. We can just try it because you're pretty end stage.
Yeah.
Well, we do the injections for him, and I'm following up, and it's every couple months. He goes, "Yeah, doc, I'm just not really not feeling it, and that's okay. And you told me, I would just take a chance at it, but it wasn't really until month 6
No kidding.
where I followed up. And he goes, Doc, you won't believe this. I actually walked 18 today, and I go, well, what the heck? Where did this come from? We were following up with you every so often, and you were telling me that really wasn't working, and I almost thought you were going to go back to the surgeon to go ahead and get the surgery scheduled. But it really wasn't until month 6 where he really started to feel something, and then something led to I can walk 18 now.
Wow.
And that really gave me the confidence to really start to advise a lot of other patients that have more chronic conditions.
Yeah.
That was just one, right? Another lady we recently did.
Well, it's incredible. I just want to share with everybody there too, is
sure.
because I think it gives people hope of being told, like, okay, I'm eventually going to have surgery, and like that's your only doorway, where there isn't, and so stem cells specifically in exosomes, it's insurance doesn't cover it,
right,
and so people like to say like, well. Or maybe you didn't offer it because insurance didn't cover it.
Yeah.
But the reality is people are paying for that guy, and this is something I want to stress, like for that guy to avoid being with his tribe, months, years potentially, to enjoy like he's a golfer, but like we could translate this to pickleball, tennis, whatever it might be. Like your longevity is directly correlated to your ability to be with the people you want, like that your identity's in that. So you're not investing in like, oh, it's my ankle or my knee or my shoulder. You're investing in my identity with my tribe.
Yes.
So that I can live longer, like, and we're not claiming you're going to live longer.
Right.
But like my parents live longer because they had things to always go to.
Yes.
You know what I mean? And so we're restoring that. And so I always like to, Dr. Ashim, I always like to tell people, like, you're already paying the price. Like, what's it cost? Wrong question. What have you already paid?
Exactly.
What are you missing?
Yeah.
So just want to share that because I think what you're doing, what you did, the gift you gave him.
Yeah.
Priceless.
Exactly. I mean, I always tell my patients, as we get older, the biggest thing that you can do for yourself, the biggest gift you can give yourself is, still being functional, still being supple, if you will, being able to move, and again, like to your point, being with your tribe, pickleball, biking club,
running,
golf club, whatever you want to do, right?
I love it.
Not being sedentary, right? But being able to move without pain, right? That's truly a quality of life.
Let's go. You're going to share another story.
Yeah. So recently we had a lady, mid-50s. She is actually a bodybuilder. Developed really bad arthritis in her large toe joint on her right foot. So we also call that the first metatarsophalangeal joint. That's just big medical words for the large toe joint, the one that allows your big toe to move up and down. Also very much end stage. She had actually done, her being a bodybuilder, she was very knowledgeable in supplements and so forth. Had never done stem cells, but was always intrigued with them. Had done around the peptides and stuff like that. So again, very end stage. I kind of gave her the same spiel. I go, look, you're pretty end stage. You got two options here. I can either send you to the surgeon that can just go ahead and weld the two bones together. You'll lose complete mobility of that joint. She's like, no, doc, we can't talk like that right now. I still work out. I need some mobility of that joint because I do lunges and I do other types of workouts. Let's give this a go. Let's do it. I kid you not. Within 2 weeks, she started feeling results.
Amazing.
And that's not normal because oftentimes I'll tell patients, I say expect nothing for at least 90 days. Okay. If anything sooner than that, that's truly icing on the cake for us. But truly give yourself 90 days to see if something is starting to take. Within 2 weeks, and I didn't really believe her at first, but as we continued to follow up, it just got better and better and better. And so again, a very end-stage joint. Other docs were saying, we just need to go and operate and fuse this thing. Nothing's going to fix this at this point. But we use these, the umbilical cord tissue that contains the stem cells and the exosomes and the growth factors and the collagens inside the joint. And within 2 weeks, she was feeling great.
Wow. That's fantastic. All right, give me one more.
Yep. Had a girl from Canada. We're very close to Canada, by the way. We're about 30 minutes from the border. So we get, we'll occasionally get Canadian patients. But we had a girl, mid-40s, really bad plantar fasciitis. Mm-hmm. It was so bad that her MRI showed that she had a tear in the ligament. And in Canada, it's a little different. They do, they have what's called socialized medicine, where it takes a long time to see a provider. It could take years to see a provider. One of her providers at the time had mentioned, hey, you should look at some PRP stuff. Go to the States, look up a doc that can do PRP. Because it's going to take you a few years to get it done here because of socialized medicine. She had done rounds of cortisone. She had done all the PT in the world. She'd even tried some of the regen there, like shockwave and stuff. But she called us and she's like, hey, I'm looking for PRP. We go, we actually do something a little bit more potent than that. Come over, we'll talk about it.
Can you stop there and explain the difference between PRP and stem cells?
So PRP used to be very, very popular. It kind of is still. Known as platelet-rich plasma. What they do is they'll stick a needle in your arm, they'll pull some blood, and then they'll spin it down. Yep. And then what comes to the top are the stem cells, and some of the other proteins and stuff like that. And then they when I say they, the provider, will then inject it, at the site of injury or the problem. So maybe it's an arthritic knee, it's a plantar fasciitis, it's Achilles, or they're supplementing the surgery that the doctor has done. The issue with that is that, again, as we mentioned, as we get older, our stem cell concentrations start to decrease.
Yeah, you're using your stem cells from now,
exactly,
at your older body,
exactly,
rather than the fresh,
the potent, the new
fountain of youth. Yeah, we're
exactly
inject it. Yeah, we're
transport. So we know that after the age of 30, your stem cells are just not as potent as they used to be.
Yeah.
If you were a kid, maybe a different story.
Yep.
But why would you use very inefficient, low quality cells when you can
use the hyper supercharged ones, which brings us to now. So she called about PRP, and then you explain, okay, well, we have something that's a little more potent and more efficient, especially and pretty much better with stem cells. Okay, so
she comes over to us. Mind you, she comes from Canada. We talk about doing the umbilical cord tissue, again, that contains the stem cells and the cytokines and the exosomes and what have you. And again, I'm looking at this tear that she has on her plantar fascia. The old me would have been like, you know what? It's been a couple of years. You're having problems. Let's go to surgery.
Wow.
Let's just operate on this thing.
Isn't that amazing?
It is crazy, right? It's amazing. And so, did the injection. It took some time. It was up until week 6, where she was like, I am finally feeling no pain in the morning. Because a very classic symptom of plantar fasciitis is you wake up in the morning, the first step the patient takes feels like this pulling, stretching, excruciating pain, right?
Is that right? Yeah.
And that's usually a typical presentation. Well, week 6, she says, I got out of bed and that pain was just gone.
Wow.
And she goes, Doc, I was losing hope because it had been week 6.
Yep.
She goes, but I remember you telling me this could take a while. It's not like the cortisone shots I used to have where I felt good for, right away, but then it wore off. This took time. But now I'm really starting to feel good. Like I'm really feeling good. I have some confidence back and wanting to go to the gym now and, doing stuff around the house, the stuff we take for granted, right? These people just can't do that anymore. She couldn't do that, but now she's able to do that. And it took time, but there you go. There's another success story right there. And I can name hundreds of more.
Well, what's interesting though is what you just remind me of is I have a buddy who runs a hospital in Mexico for they see late stage cancer patients, and he always would say to me, Ed, I wish they would come to me when they were at stage 1 or stage 2.
Yeah.
He's like, we're getting the people we have to produce it's extreme cases.
Yeah.
And so one thing I want to say to our audience was, don't wait. If you have the option to come see Dr. Ashim. And you're earlier in your, I don't want to say degenerative phases or on the post-injury cycle,
Right.
come see him sooner,
Right.
so that you're not waiting 6 months to get the result. Because I'm not going to speak for you. I'll let you comment on this. I would imagine that if I came to you sooner, the likelihood of getting a quicker result is much more likely and much higher. Is that fair? Accurate?
That's very accurate. Again, if you're treating something that's very damaged, it's going to take a while.
Took a long time to get there, or it was severe of a catastrophic something that got us there. Yeah.
And the simplest way to explain it to somebody is that this injury, this problem didn't just occur yesterday.
Yeah.
It's been going on for a long time.
Yeah.
So we can expect this to take take longer to heal itself, versus if you'd come in sooner to see us, if we hadn't waited. See, but again, the problem is that a lot of patients, the first thing that they do is they're going to go to the traditional doctor, and they trust the doctor, and the doctor's doing what we call their standard of care, right? And so the patient's like, okay, I'm just going to do what the doctor says because this is what he's telling me, this is what she's telling me. And it's not until they have to go through a few second opinions to figure out, okay, this doctor's doing something a little bit differently. Seeing the stem cell stuff, I'm hearing about the stem cells. I know it's getting really popular now. Let me go see what this is all about.
Right.
Oftentimes by then I am like the third opinion. It's been going on for a year and a half, and I hear it every single time. I wish I found you first. I wish I started this earlier because I know I would have fixed myself much sooner.
Yeah.
So
that's great. Okay, cool. Last couple of things. So on the regenerative medicine side, now that's kind of a bigger umbrella now. Stem cells and exosomes are kind of like the leading edge, and then you have other different devices, tools, things. Can you what other elements of regen medicine are you either doing in the practice or is it on its way?
So I'll share a little story here. So we were getting so many patients that were coming back saying, Doc, my ankle's feeling so much better after we did the stem cells, after we did the exosomes. My heel pain's gone. Hey, that surgery that was botched, it feels so much better after you injected. Hey, I got a question for you. My knee is hurting. Do you think you can just quickly inject my knee? Doc, my shoulder's giving me some problems. I have a labral tear. Hey, I went to see my surgeon. I have end-stage knee arthritis. They're looking to replace my knee, but I remember you did the stem cells. Can you do that for my knee? My back, my neck, every body part you can imagine, my hands. I'm a podiatrist. I have limited scope. I really can only treat below the knee. So I was like, sorry, I can't. That's out of my scope. We can't do that. And then I was like looking around to see what kind of refer them out to, this, that. And then, we got to thinking and go, why are we, let's fix this. The chiropractors are doing this thing where they become what's called medically integrated.
Okay.
They bring on a whole team that can service the whole body. So I got to thinking, I go, you know what? We're going to do the same thing. We're going to bring on an awesome medical director. We're going to bring on a team of nurse practitioners, and I'm going to start fixing the whole body at this point.
So the art of foot just became the art of the body, but we just don't know the domain name.
It's actually called the art of regenerative medicine.
I love
the art of regenerative medicine.
Good job.
We got that going, and I'm so happy because now I can service my own patients that are saying, hey, Doc, the knee hurts. Can you fix it? The shoulder hurts, can you fix it? My hip's hurting, can you fix it? We absolutely can do all that now. So the same stuff we're using for the foot and ankle, we're now able to use for the whole body.
Well, and to give you a lot of credit, the one thing is that you've kept asking the same question. Which is, how do I help people more? And it just keeps leading you. So I'm super excited to see where that continues to lead you. And so as of right now, people would go and find you at theartoffoot.com or artoffoot.com.
Theartoffoot.com.
Okay, great. And do you know your phone number off the top of your head?
I do.
Because you'd be surprised how many people do not. So this is so good.
It's 248-341-0602. You can also find me on all the social media platforms. It's going to be still at Dr.Wadehra. So Dr. Wadehra on Instagram, TikTok, YouTube, Facebook, and so forth.
And where are you located at?
So we're in Metro Detroit. So we're in a city, it's called Birmingham, Michigan. It's a very beautiful city just outside of the Detroit area, about 30 minutes north of the city of Detroit.
And what's so cool about regenerative medicine, especially with stem cells and everything you're doing, is people are willing to travel
Oh, yeah.
to come see you because, and so I'm encouraging everybody out there, you know, the level of treatment, if you like what Dr. Wadehra is saying, and we could vouch for him as well,
Yeah.
that this has been super educational for me. Make the appointment, go on in there and see him, and I just look forward to hearing so many more of your success stories, and congratulations. It's been
Thank
great.
you. Appreciate that.
It's been great.
Awesome.
So, all right, thanks everybody. We for watching. We look forward to seeing you on the next episode.